We'll talk about the basic post-operative order. So for the basic post-operative order, it's more of like, okay, after the surgery, what are the things we actually need to do to a patient, all right, that will actually seem to say, okay, yeah, this patient was, after the surgery, the patient was well attended to. So for the basic post-operative surgery, you say that there are standardized instructions and they are given after surgeries to ensure that the patient is well, the patient recovers well, the patient is at comfort. So let's look at them. Now, you should know that after the surgery, you continue monitoring the patient vitals. That's all those temperature, heart rates, blood pressure, respiratory rates, oxygen saturation. So initially, just immediately after the surgery, 15 to 30 minutes, you always check it. Then as the patient is much more getting stable, you can now span your time. The neurological techs, this is where they are now checking if there's any injuries to, the nerves, central nervous system, peripheral nervous systems, and all of that. Then moving, you can now be giving some medications after the surgery. Very important ones is to almost every surgery, there's pain. So you give pain relievers. Then of course to every surgery, probably they gain access into the person. So you're actually trying to give antibiotics because bacterial infections are very much more common. Then probably there's surgeries where the patient will be bedridden for a very long time. You can now start giving drugs against deep vein thrombosis, okay? Then resume home medications, okay? So fluid and electrolyte management is, if the patient lost a lot of blood, of course, to most surgeries, okay, you can start giving all those IV fluids, normal saline, ringas, lactate. Then the rate is based on the patient weight and how much they lost, okay? You can't actually give a single respiratory fluid regulation to all patients. Then electrolyte monitoring, of course, as we're losing the fluid, we're also losing very important electrolytes in the body. Then intake and output is you keep checking out for the urine output, the drain output, the oral intake, then their activity and position. You see most of them, the bed is actually 45%, or depending on your patient, you always position the bed as they will prefer. Okay, then wound care, where they do it daily or within a day, they do it twice, dress the wounds, check for bleedings, check for infections. Then they can continue doing some laboratory tests like imagings, okay, complete blood count, electrolyte, all of this. Now they have treated you, so they're trying to monitor how you are recovering from the condition. All right, so that's what we got for this.